The AI makeover for the Royal Flying Doctor Service, how is it going with it? Tell me more about that.
Well, Mike, I was lucky enough to go to an event down in Adelaide in their big hangar there. If you're the flying doctor and you're trying to pick up a patient who's had a heart attack or a stroke, you need to find their history really fast. So they've found a way of tapping into the My Health Record and to some private repositories to get basic information about whether you have an allergy or what medication you're on, because that can totally change what the treatment's going to be when you get into that plane as a patient. So that's number one. Number two, the nurses on those flights spend quite a bit of time transferring data from the readout devices that they have into the system that can collate it. So instead of that, they'll be able to do one of a few things. I'll either be able to just call out the data and have text, voice to text recorded in the system, or AI can get a screenshot of the screen of that device, particularly if it's an older device, and work out what the reading is and record that itself until they have Bluetooth devices that just can transfer observations straight into the My Health Record or into the hospital that is going to receive that patient. And that's the third thing, is that hospitals will be able to monitor in real time what the observations are for those patients. So if there's any changes in conditions, they'll know about it straight away. And they've done a test which showed that on a 2-hour flight with a patient, they save something like 28 minutes or 26 minutes rather of administration time, not having to do that role, which they can then spend with the patient. So that is all about using basic record keeping to provide much better time for actually working out what's going on, not giving patients stuff they're going to be allergic to, and warning the hospital that's going to receive that patient what the condition is in real time. And that in turn has been aided by the advent of Elon Musk's Starlink. While they can get like 4G connectivity in a lot of the state, they can't in Central Australia because it's just too remote. So Starlink has been of value to them. But the issue with Starlink was, until not so long ago, they'd have to land the plane, put up their Starlink receiver to be able to communicate. It's only in the last year, and for light aircraft like they have in the last few months, that Starlink now has an iPad type device. That means that they can actually transfer data to and from Starlink from the moving plane as they're going along.
Do you have any idea what this has cost?
The cost of the innovation will be equipment costs. The big cost, of course, is the cost of having a flight and a crew going to these remote places. And that's covered mainly by Medicare or private insurance. But that's the price that Australia has to pay for having people live in the outback, because if you can't provide decent medical services, or at least some medical services, then people are just not going to live there at all. We're struggling as it is to have people live in rural, remote areas.
I'm truly impressed with the Royal Flying Doctor Service. I think one of the great organisations that we've ever had, and the amount of good they can do. But you're right, the 2-hour flight. I mean, anything can happen, and to have your connectivity with the hospital, as you mentioned, I think they saved 22 minutes or 28 minutes.
26 minutes, yeah, that's right.
That's just absolutely amazing, and it saves lives, doesn't it?
Now they've got the Starlink option, and now they've got this new device that they can use Starlink while they're moving at up to 400 kilometres an hour without having to land the plane, put up the Starlink receiver, is going to be fantastic for them. For instance, it does make a big difference with those time saving. If there's particular issues with a heart patient on the flight, then the hospital that's receiving can get in the medication they need for that when the patient arrives, or be prepared to deal with that eventuality. Just very briefly, in the middle of nowhere, not far from Lake Eyre, they have a little hut. If you go into that hut, you'll be met first with an AI receptionist you'll be able to either yourself, or if you happen to have someone with you, do the vital sign test, blood pressure, all those types of things, and do tests. Their doctor down the line will immediately be able to get those tests, and based on that, they can triage you. And if you really need to have a plane, they can then send it. So you've got some capacity now for remote diagnosis. It's only the first of these, but there'll probably be, hopefully, a lot more that roll out. Unfortunately, it's too expensive to have medical staff right throughout the outback, and that because we've got not just the tyranny of distance, the large distances, we've got the sparsity of population as well. So that means it becomes very expensive if you're going to have a general practitioner locally.
I'm just amazed. I'm amazed at technology, and here is technology saving lives